What is the main symptom with endometriosis?
Bad period pain,
Yeah.
and heavy periods. You can also have silent endometriosis
Yeah.
where you have no symptoms. The average age of having a baby now in Australia is 31, and we're
Wow.
only going to see that climb. We do see a lot of girls who are underweight, and what that does is causes a condition called hypothalamic amenorrhea. Men are actually becoming less fertile as well. Now, we know that smoking affects sperm as well, alcohol affects sperm, we know that laptops on their laps affects their
Wow.
sperm, mobile phones in their pockets.
Welcome to Train the Brain Pod. On today's episode, we have Dr. Lynn Burmeister, who is the fertility queen. She is the owner and medical director at No. 1 Fertility. She has over 30 years experience and the highest degree in fertility. Today we're talking all things hormones, longevity for quality and quantity of your eggs, and just things that you can do as a woman to better your health. Thank you, Dr. Lynn, for coming in today. I so appreciate you taking the time. I know that you're such a busy lady and you are the queen of fertility, so I really appreciate your time being on Train the Brain Pod and helping educate women on fertility and hormone regulation. I wanted to sort of start from the perspective of, say, your daughter Tatiana's age or early 20s, who is wanting to help optimize the longevity of their eggs and their fertility and their hormones. I wanted to sort of explore with you which tests you would recommend that someone should be doing, as we have such like a lack of education around going to a gynaecologist and things. So how important is that?
I know. So most of our sex education was around trying not to get pregnant.
Yeah.
And I'm seeing everyone in their 30s who can't get pregnant. So I think it's very important that if you are in your teens or your 20s, that you take notice of your symptoms.
Yeah.
So things like bad period pain, heavy periods, they're not normal. So it takes on average 6 to 7 years for a woman to be diagnosed with endometriosis.
Wow.
So if you do have bad period pain, then it's really important that you do seek medical assistance. That might be seeing your general practitioner first. And if your general practitioner can't help you with your period pain, then you should see a fertility specialist like me or a gynaecologist that can diagnose you with endometriosis, which is one of the most common fertility problems that we see and one of the most common conditions gynecology-wise that we see as well. So about 15% of women will suffer from endometriosis, but that's probably an underestimation. There's probably many more women walking around that haven't been diagnosed with it and just live with period pain every month. And it's a very common solution just to pop them on the pill without even doing an ultrasound. And for instance, I saw someone yesterday at 31, she's been on the pill since she was a teenager, never had an ultrasound.
Yeah.
And so when we did the ultrasound, she had a big chocolate-filled cyst, which
Wow.
look like, when you open them up, they do look like chocolate. And her pelvis was filled with endometriosis. So if she had been diagnosed, say, 10 years ago, it wouldn't have got to that stage where it became quite destructive for her pelvis.
So what is the main symptom with endometriosis?
Bad period pain,
Yeah.
and heavy periods.
So
they're
clotting
the two, and clotting and staining your clothes and things like that. So
Yeah.
they're the two main things. You can also have silent endometriosis
Yeah.
where you have no symptoms, but anyone with bad period pain, clotting, heavy periods should get some assistance, at least a simple ultrasound to start with, and that will diagnose whether your endometriosis is severe.
What age should people get that tested?
Even when you're a teenager, if you've got bad periods,
Yeah.
you should be going to your mum and saying, take me to the doctor, I need help. And then the doctor will hopefully help you out. And if the doctor doesn't, then you need to see another doctor. Some
Yeah.
doctors just ignore women when they complain of pain.
Yeah.
Thinking it's all in our brains, but it's not. And I think it's very important to find the right doctor who will help you
Yeah.
with any symptoms that you have. And another common condition that we do see is polycystic ovary syndrome, which again is very poorly diagnosed. And that's where girls have very irregular periods and then often suffer from acne and hair growth on their face, difficulty losing weight, and that's very poorly diagnosed as well. So again, if you have symptoms like that, that's when you see your doctor. If your doctor can't help you, then ask for a referral to your gynaecologist or a gynaecologist or fertility specialist like me.
Yeah. Is it generally genetic, PCOS and endo?
We think so. Well, definitely endometriosis, there's strong links with genetics. So if your mum's had endometriosis, you're more likely to get endometriosis. If your sister's got endometriosis, you're more likely to have it. So definitely with that. With polycystic ovary syndrome, we're not sure whether there's genetic or environmental components, but certainly some of both. And it might be your diet and lifestyle that actually can tip you into having the syndrome. So if you're unhealthy, not exercising, overweight, you might actually tip yourself into having the syndrome. So again, staying healthy during your teens and also in your 20s is very important, and eating a very healthy diet. And we usually recommend Mediterranean diet, which is basically fish, chicken, nuts, legumes, green leafy vegetables, and trying to cut out the fake foods, so to speak, like takeaway foods and processed foods.
Yeah, so what about if someone has been a bit underweight, so say like an eating disorder, would that sort of lead to PCOS as well?
Not necessarily PCOS. So a lot of girls with social media posting photos of themselves in bikinis and things like that. We're seeing more and more of that. So that's like a competition who can be the skinniest, which is not great for your fertility. And we do see a lot of girls who are underweight. And what that does is causes a condition called hypothalamic amenorrhea. So that's a mouthful of words, but hypothalamic amenorrhea. So basically your period starts in your brain, and so your hypothalamus feeds to a gland called your pituitary gland in your brain, and then that sends off signals to your ovaries, and that's how you get your period. So when you over-exercise or don't eat enough, that breakdown in the communication stops, so then the hormones don't get released down to the ovaries. So that's when you do need to see someone like a fertility specialist to diagnose you properly, because again, a lot of girls that I have seen with hypothalamic amenorrhea, they've been falsely diagnosed with polycystic ovary syndrome and then given the wrong treatment. So again, that's diagnosed with a blood test and an ultrasound, and then we can usually tell you whether you've got polycystic ovary syndrome or hypothalamic amenorrhea. But you can fix up hypothalamic amenorrhea. Sometimes it does take a while to fix up. I have a lot of patients that are ballerinas, for instance, who don't eat and sometimes smoke cigarettes to stop them from eating. And I always give them a lecture about smoking. And so it takes a few years for them they almost have to stop ballet and get back to a normal eating pattern and
regular BMI.
And usually your period does come back. Sometimes I have to give patients with hypothalamic amenorrhea medication to make them ovulate, but they're usually easy to treat and easy to get pregnant, because it usually is just an injection that helps them ovulate. It's not that they've got infertility because they've got bad eggs or something like that.
So does having PCOS or endo affect your long-term fertility?
Yes, unfortunately it does. So if it gets very severe and it goes into the ovaries and eats into the pelvis, this is endometriosis, it behaves like a cancer. So it's not a cancer, you're not going to die from it, but it basically glues everything up. It's like putting glue in your pelvis. And so the tubes get blocked, the ovaries get damaged. So unfortunately, if it's not diagnosed early, it can get to a stage where it's stage 4, which is the worst endometriosis, and it can then damage your fertility. Yes, we may be able to do IVF and help that, but obviously we would like you to avoid IVF and get pregnant naturally. So if you do have symptoms in your teens or early 20s, best to get it checked out and make sure it's not severe. And see a doctor regularly, like if you've got a gynaecologist, pop in and see them once once a year or twice every 2 years or something like that, just to get checked out properly, that you don't have any gynecology problems.
Is that the same with pap smears? Should you be getting those regularly tested as well?
Now there's a new initiative it's called the cervix screen test, or the cervical screen test, and it's every 5 years from when you're 25.
Okay.
And you can actually even do home kits, so you don't have to see a doctor for that. So if you've had no past history of any abnormal smears or any abnormal tests, you can do it at home. So you can get the kit from your GP and do it at home. So there's no excuse for not doing it anymore. And so they've made it much easier now, and including with the HPV vaccine, when you had that at school, it's quite rare that we are now seeing HPV popping up, and HPV was the most common cause of cervix cancer.
Wow. So in terms of the pill, you mentioned before that doctors just sort of prescribe the pill. There's so many different contraceptions now, but with the pill in particular, I just remember sort of copying what one of my friends took at the time, and I felt like it just masked period pain, and that was just sort of the solution. Is that, in your opinion, a Band-Aid for period pain? And is there any tests that we should get done to go on a specific pill if the birth control pill is the choice of contraception?
Yeah, there's so many pills out there. So there's low-dose pills, there's medium-dose pills, there's high-dose pills. There's the Mirena IUD, there's the copper IUD, there's the ring, which secretes hormones as well. And then there's that rod in your arm called the Implanon rod that can work as a contraception as well. So there's such a big variety for you to choose from.
Yeah.
And I think it's important to discuss with your doctor which one's the best. And some of the pills are based on different ingredients. So some newer pills have more natural ingredients and are more natural, so more prone to simulating our natural estrogen and progesterone, and they might suit you better than, say, an old-fashioned pill with an old-fashioned progesterone that might cause a bit of depression. So a lot of girls feel depressed on the pill, and that might be because they're taking an old-fashioned progesterone. But what's happened over the last few years is the Mirena IUD seems to be very, very popular, and with people for contraception as well, and that basically stops your period after a few months. So most women love that, and after it's removed, studies have shown its immediate return to fertility. So that's quite good, and particularly if you've got endometriosis, it actually helps treat the endometriosis. So that's a good form of contraception. Don't get your period, don't have to worry about anything, and then just change it every 5 years.
So I think people also are under the impression that if you are getting your period, it's like a natural flow as well. So, for example, if you're on the pill and you're not taking the sugar pills, and obviously it's great because you're not getting your period, does that affect anything long term or anything internally?
No, it doesn't actually, because the period that you're getting on the pill is what we call a fake period.
Yeah.
So a lot of my patients actually skip.
Oh, okay, yeah.
Yeah, they skip the pill. They skip the sugar tablets, so they don't get a period at all.
Yeah.
And they might give themselves a break every 6 months, but still they're just getting what we call a fake period. And also some women think that if they go on the pill, it preserves their eggs, which that's not true actually.
Okay.
So nothing actually preserves our eggs. I mean, healthy lifestyle and exercise and not smoking and drinking and taking illicit medication or illicit drugs, they're all going to damage your egg supply, but the pill doesn't protect your egg supply. So a lot of girls go, oh, I've been on the pill, I must have lots of eggs. That's not actually the truth. So we are losing eggs all the time, and the word for that is atresia, which means the eggs are just being gobbled up by our body. So every month we lose hundreds and hundreds of our eggs, and then by the time we're 40, we've only got about 4% of our eggs left.
Wow. We'll get to egg freezing in a minute, but I just wanted to touch on what you just said before with nutrition and a healthy lifestyle. So from the perspective of a young female, but then also if you're trying to conceive naturally, how important is exercise and stress management and low inflammation and nutrition on, pretty much your healthy lifestyle on if you are trying to conceive?
Yeah, so we never thought that was important back when I first started. I've been doing fertility treatment or gynaecology for now 30 years. So no one worried about any of that. And no one worried about people smoking, and no one worried about how much alcohol they were drinking, and particularly men. They didn't worry about men smoking. So if the female didn't smoke and the man smoked, we'd go, oh, okay, fine. But now we know that smoking affects sperm as well, and alcohol affects sperm. We know that laptops on their laps affects their sperm, mobile phones in their pockets. So men are actually becoming less fertile as well. So over 100 years, their sperm has dropped by about 50%. And also their shapes of their sperm are changing as well. So men are becoming more infertile, women are becoming more infertile. And so looking after your diet and exercising in your 20s is very, very important, and trying to not drink too much, definitely not smoke or vape, and staying away from, drugs is a protector for your eggs as well in the future.
So in terms of exercising and nutrition, is that more for a healthy BMI, not being too overweight and not being too underweight?
Exactly. So we know if your BMI is over 30, your fertility starts dropping. So we want ideally we want your BMI to be between 19 to 25 for a healthy lifestyle moving forward, and to protect your eggs too. So
just a quick interruption. If you are enjoying this episode, then make sure that you subscribe or leave a review. It would help us out a lot. In terms of cortisol or stress management with the exercise, just because I'm a trainer, so I want to tap into that. But what style of exercise would you recommend a woman that is trying to conceive?
So I usually recommend that they attend things like Pilates or
low impact,
more low impact exercise, just to try and not have so much cortisol being released, and also to reduce their stress as well. So we want them to be stress free. So I have some patients that love running, and that actually makes them stress free. So as I say, okay, well, if you love running and you actually feel less stressed, then that's probably good for you, and you're running every day. I find it funny when I do an embryo transfer and the patients go, "Shall I join the gym now, doctor?" And I'm like, "Have you been at the gym?" And they're like, "No." I'm like, well, now's not the right time to join the gym. So doing it before you get pregnant is probably the best time. So exercising before you get pregnant is definitely important, and keeping at a healthy body mass index in your 20s and 30s, particularly when you're trying to have a baby, is really important. And some people love high impact exercise because it does actually, they find it reduces their stress. And so if that reduces their stress and they feel better when they do it, then I don't mind them doing it. It's just after I put the little embryo in, I actually say calm down the exercise a bit, like do Pilates, don't do hot mat yoga, because we don't like the little embryo overheating in there. But Pilates and things like that are quite safe to do after you have your embryo transfer.
I did hear something about saunas for men it's not as good for their sperm health.
So anything that overheats the testicles has been shown to lower the sperm count. So I actually tell my men, which is quite funny, to actually ice their testicles once a day. So get a nice pack out of the freezer, wrap it in a towel, and plonk it on their lap while they're watching their favourite Netflix movie. So just for half an hour a day. They all look at me very strangely, but that has been shown to improve their sperm function, quality, and DNA fragmentation as well, because that's what we're seeing in men, that they have a higher rate of DNA fragmentation. And that's probably, we haven't got a test for women's eggs for that yet, but we do have a test for men, and we're seeing men's DNA fragmentation increasing as well. And so what we want to reduce is that fragmentation of their DNA to create a healthy sperm, and we want women to try and reduce that as well to help create healthy eggs, and then we'll get a healthy baby at the end.
Beautiful. What are some of the key nutrients that you can start implementing in terms of nutrition, other than omega-3 fatty acids, obviously good for inflammation and hormone regulation, but is there any other?
And probiotics are very good as well, so a really good probiotic. And I think that's where you sort of need to get some advice about what probiotic to take, because when you go into the chemist shops, it's quite daunting with all the probiotics on the shelf. So I think it's very important to get some expert advice as to which one you should get. I tell my patients to try and get it more naturally. So go and buy kimchi or kombucha.
So gut health.
Yeah, kombucha or sauerkraut, and try and take it more naturally than just buying in a jar where it's been sitting on the shelf for a while.
Yeah.
And if you are buying one from a jar, just make sure you're getting a good one and one that's not in a clear plastic, because if that's been exposed to the sun during its travel to the chemist, then the probiotics probably been killed in it on the way. So,
And chemicals.
yeah, and chemicals as well. And chemicals are very important as well. And we are more exposed to chemicals as we're moving along in life. And pesticides, we know that pesticides are very bad for eggs and sperm. And a lot of the chemicals, like we know that Glad wrap now, if you heat your food up with Glad wrap over it, that's very bad. And plastic containers, heating your food up in plastic containers is really bad as well, which, like, I grew up doing that.
Yeah.
And so now there are special containers you can buy for your makeup,
glass
for your
ones.
microwave, that will keep your food safe and away from the nasty plastics.
Is that the same for pregnant women that have an unborn child? Is there an impact on their future fertility? So is there anything that like a mother can do to try and help their longevity of their eggs?
Yes, so when we're a fetus, we have millions and millions and millions of eggs. And when we're born, we've got about 1 to 2 million. But we actually start with millions and millions and millions of eggs. So whatever your mum is doing as well can affect that millions. And so that means smoking or exposing herself to plastics, pesticides. Even they're saying cosmetics can be harmful to your eggs as well. So, and the deodorants we use and perfumes that we use can also affect egg quality and also your unborn child as well. And it's very important to have a good prenatal supplement before you get pregnant, and maybe even in your 20s, look for a good supplement that has folic acid and things like that that are good for your eggs. And we're now finding that we don't absorb, or 50% of people don't absorb folic acid very well because we're missing a gene. And so there's new fertility vitamins or pregnancy vitamins that are out. And this one, for instance, is Bump Plus. And that's got a methylated folic acid that doesn't have to go through the gene to be absorbed by your body. So it's important that you get advice about what pregnancy vitamin you should be taking as well.
Where can people find that supplement?
This one's currently online, but there are a few with methylated folate in some pharmacies, but they're hard to get to. They're usually behind the counter and you usually have to ask the pharmacist for them.
On supplements, what are some that you would recommend for, let's start with the early 20s, as a young woman? Is there anything that you can be supplementing to help with the egg quality or quantity?
Yeah, so I think natural is great if you can have a really healthy diet. And we do know that blueberries are packed with antioxidants and are fantastic for your eggs. So a punnet of blueberries a day, low in calorie. But organic if you can, because the ones that are non-organic are covered in pesticides. And so blueberries are great for your eggs. So nutrition first, and then probiotics, and then, just a really good multivitamin that is packed with high-dose antioxidants and things. I often tell my patients to take things separately because in one bottle or one jar you can't get as many nutrients as you need. So, for instance, we know coenzyme Q10 is amazing for eggs. It actually has been shown in studies to increase the mitochondria of the egg. So the mitochondria is like the light bulb to your egg. So if your mitochondria is dull and not working, it's a bit like a light bulb, it's not going to function as well. So the mitochondria, we want them to be bright and shiny, and we know that coenzyme Q10 actually helps them become bright and shiny and also helps the quantity of them increase. And we also know that that might also be an anti-aging thing as well. So the mitochondria are the things in our cells that decrease as we age. And so that's like our light bulb is dimming as we get older. So coenzyme Q10 is probably, will be an anti-aging medication or supplement as well.
So interesting how nutrition has such a correlation to your fertility. It's mind-boggling that back in the day you just never educated on things like this. Like how you said at the start, sex ed is just always about contraception, but just never about all of these little tools. And
and that's why my daughter Tatiana's come up with her product called Fertility, which will be launching in February, and it's basically a powder that is just, you put it in with your smoothies or just water. It tastes quite nice. She's got a few different varieties, and she's got a hormone elixir one and one for fertility, but she's trying to encourage it to women in their 20s to take it so that they look after their fertile health. So when they want to have a baby in their 30s or in their late 20s, the eggs are going to be in prime condition.
That's great. And the fact you can put it into a smoothie as well is just so easy.
Yeah, or a glass of water. I drink it too. And you just put it in a glass of water and makes me drink water because I'm not a big water drinker, but if I put something in it, I'll drink it.
So Fertility, and that's coming in Feb.
Yes, in Feb.
Cool.
She's launching that. So,
amazing.
So that's exciting.
Go Tat.
Yeah. So I gave her the idea in COVID, actually, because she did a marketing degree, and she really didn't. Everyone was a bit lost in COVID, what we were all going to do, and so I said, why don't you try doing this? And she just went off and did everything. She found the person to manufacture it.
Amazing.
Who would do the packaging. So she's actually sourced who stores it for her. And so she's done everything. I haven't really done anything apart from help her with the formula.
Yeah. And you were saying earlier that her and all her friends have been and had their eggs tested.
Yeah. So when... So Tatiana's now just turned 25.
Yeah.
So a year ago, her friends started asking me about their egg banks. All of them were coming up to me. They're often at our house anyway.
Yeah.
And so they were all starting to ask me about getting their egg bank tested. So I thought that was quite amazing at 24. They had so much interest in it. And we did test everyone's egg bank, and some of them did come back low. So we're just going to keep an eye on it. If they keep dropping, though, we might actually have to freeze their eggs in their 20s. So we don't normally freeze eggs in your 20s. We normally wait till early 30s to do it. But if your egg bank is low in your 20s, you might need to consider egg freezing.
Wow. So you would recommend, like, what is the best age for freezing your eggs?
Well, your eggs are the best when you're 24. So they're your peak eggs. Yeah. After 24, they start declining in quality, but they don't decline dramatically until we're about 35.
In quality, not quantity? In quantity as well, obviously.
Yeah, quantity and quality.
Okay.
But their peak at 24. So the peak quality is 24.
Amazing.
The quality will start declining after that age, and the quantity starts dramatically declining after 35. So sort of semi-stable up until 35. Yeah. And then after 35, it's almost like a sort of a downhill slope for quantity and quality. So I also see a lot of girls 38, 39, 40 coming in to freeze their eggs, and I often ask, how long have you been thinking about it for? And they'll often answer 5 years, and I'm thinking, well, yeah, maybe 5 years ago you should have come in, but I suppose 38's better than 40, so we usually still go ahead with egg freezing because it gives them some chance of having a baby. Not as good as if they had frozen their eggs in their 30s, but it does give them some chance of having a baby. There's a lot of single women out there at the moment, and I don't know whether that's post-COVID where they couldn't get out and meet men, and so there seems to be the egg freezing. Like an egg freezing boom. It's like
it is, isn't it?
There was the baby boom, I think, was that in the 50s. Now there's the egg freezing boom, and so there's so many girls. I think half my business is egg freezing at the moment. So many people are inquiring about it or even actually doing it, and it is quite daunting because you've got to do injections for 10 days, then you've got to have a minor surgical procedure to get them out, and so it is a bit scary during the injections and going into surgery when you've never potentially had surgery before. and you're not going into surgery because you're sick. You're going in because you're trying to preserve your fertility. And most girls who want to preserve or do preserve their fertility, they'd rather be in a happy relationship having a baby than freezing their eggs.
Yeah. So there's a bit of an emotional side to that as well.
A lot of the girls wake up crying after their egg collection, you know, because they're thinking that they're single and they don't have a partner. So it's a lot of emotion attached to it.
Yeah, I read on your website a lot of facts, and I was particularly interested by what you just said before about how when we're born we have 1 to 2 million. By the time we're a teenager we have 400,000 approximately, and then by 30 it's 10% left, which was just mind-boggling to me. But how much of it do you think is a little bit of a trend or a hype, like you said before, or how much of it do you think is really crucial for people?
I think it's crucial for people. I think we weren't educated about it at school. I think we were educated about not getting pregnant, and I think it's crucial. It's probably happened since our parents' days, but my mum had her first baby when she was 21, so it didn't
Getting
sort of
later.
It's the average age of having a baby now in Australia is 31, and we're
Wow.
only going to see that climb. And so you might be able to have a baby when you're 31, but by the time your baby is 1 or 2, you're going to be 33 or 34, and then we start seeing the decline in the egg quality at 34, 35. And so that second baby may not come along that easily, and that's when they come and see me for their second baby because their egg quality has declined. But if they had frozen their eggs in their late 20s or early 30s, then they might be able to use those frozen eggs for their second or even third baby.
Just a quick one, if you're wanting me as your PT in your pocket and wanting my coaching and guidance personally, then you can download the Body Active app and the link will be in your show notes. What do you mean by egg quality? Just because obviously I know that the quality declines, but for those at home that have just no idea what that means, how can you best explain that briefly?
No, so an egg's a really complicated structure.
Yeah.
It's much more complicated than...
To you it's like second nature.
Yeah. So it's much more complicated than sperm. So sperm has a head and then it has a tail that's meant to move. And inside the head of the sperm, it's got 23 chromosomes, and then it might have an X or a Y, then that's what makes your baby a boy or a girl. So they don't really have to do much once they get in the egg. So, but the egg is complicated because it's got 46 chromosomes, and then it's got an X and an X as well. And those 46 chromosomes are all joined together in pairs. So they're joined together in 23 pairs, and they're joined together so they sort of look like that in a way, and wrapped around that middle bit is what we call a spindle. And the spindle is like an elastic band. So I always say to patients, it's like an elastic band, and imagine if you left your elastic band on the shelf in the window in the sun, that elastic band's going to snap after a while, isn't it? So as we're getting older, what happens is these elastic bands snap. So when the chromosomes are meant to split, they don't split properly. The elastic band snaps and they get all jumbled up, and that's how, as you're getting older, when the sperm gets into the egg, the egg doesn't fertilise, or the baby could be sadly born with some abnormality, like Down syndrome or Turner syndrome or Edwards syndrome, or there's so many syndromes I could list off. And so if that chromosome doesn't snap properly or divide properly because the elastic band is old, then that's when the egg quality is deteriorated. And that's where the mitochondria can help, because the mitochondria feed the spindle and keep the spindle healthy.
Yeah, that's a really good explanation, especially for those that could see it. So it was basically like you had your hands together and then the band was around it. But
It's a bit like one of your exercise bands. You have to
I was
push your
actually
knees in and out.
I was thinking that as well.
Have you ever had an exercise band snap?
I actually have one of those little flimsy ones. I'd hope so, because that means that my glutes are growing. So a lot of people, I think, are unaware as well that egg freezing is the start of the process of IVF. So they're not two separate.
Yeah,
things.
it's exactly the same, really.
Uh-huh.
We're just not fertilizing the egg. So it's IVF without fertilizing the egg.
Okay.
So they have to do everything the same. They have to take all their vitamins, their, fertility vitamins. They have to take everything to prepare for it. So it takes 90 days to make an egg and a sperm. So after 90 days, those eggs and sperm will die, and then a new batch will come through. So every month we've got a new batch of eggs. So for those 90 days leading up to your egg freezing or your IVF, you need to be really healthy as much as you can be. Exercise, diet, what we were saying before. I give my patients a long list of supplements to start, and the pharmacist all puts it in a bag for them now, and they take that bag home, and usually they carry like a little pill case with them in their handbags, and divide their vitamins up during the day. And I really do think it does help their egg quality and their sperm quality by the time we get to that egg collection day.
So what would be someone's first steps if they were looking into freezing their eggs?
So firstly, go and see your GP.
Yeah.
Your GP, you could ask your GP to organise a fertility assessment. If the GP is looking a little bit confused by that, then ask to be referred on to I have fertility GPs in my clinic, or they could be referred to someone like me, and then we would send them out a blood test with their egg bank on it, and we would send them out an ultrasound form so they could look inside their pelvis and just check that their organs all look okay inside, because we don't know what everything looks like inside. And so we do a baseline ultrasound, a blood test. The ultrasound, depending on what clinic you go to, can be bulk billed. So if you source out a clinic that bulk bills, great. But sometimes the ultrasound might be between $200 to $300. The anti-Mullerian hormone test, which is the egg bank test, that's about $90, and that's not recovered. You can't get that back from Medicare. So the egg bank test, anti-Mullerian hormone, that's secreted by the tiny little follicles in your ovaries that we cannot see. So when we do an ultrasound, we'll see follicles, and they're little black circles that are I call them the egg sac. And so we can count them, and if they count to a good number, we'll say, well, your fertility looks quite good. If they count to, say, this morning I saw someone with only 4 follicles in each ovary, so I had to sadly say that her fertility was low, and she probably does need to egg freeze, and her AMH test came back low too. So I always say to women, your AMH is like petrol in your car. You can't really see it. It doesn't really make sense. But your petrol in your car could be really high and you don't need to fill your petrol up, or it could be really low and you're about to run out of your petrol, and that when your egg bank is low, it's indicating that you're about to run out of your eggs. So you need to do something about it.
And number one fertility, do you have 4 clinics? Or
so we were open in Geelong, but during COVID we found it too difficult to get back and down. We were standing in those long police lines, to show our driver's license and things like that. So during COVID, we stopped the Geelong clinic, but we do have, how many sites have we got here? 3 sites here at the moment. So,
amazing.
yeah.
And you opened in 2020, is that correct?
That's right. So we opened in 2018 in Geelong.
Oh, okay.
Because when I left Monash, I had a restraint, and the restraint was actually a long restraint, and we had a bit of a legal battle and got it down to 50 kilometres 1 year. And then I got home after the battle thinking I'd lost. And then I thought, no, I don't lose in life. So I got on the computer and I Googled 50 kilometres outside Melbourne, and then I found Epworth Geelong, which was a brand new hospital that had no patients. And so I knew the CEO there, and I phoned him and I said, would you like me to start an IVF clinic? He goes, how quick can you do it? I said, give me 3 months. So
amazing.
Within 3 months we opened our first clinic in Geelong. And I had a friend who drove limousines who he told me he was going broke because of the Uber drivers. Oh. So I said, okay, I've got you a job. And so he would drive the patients down, his team of limousines. And so basically
pink?
all the patients stayed with me, and he drove them back and forward to Geelong for their egg collections, and they got a nice little pack of sandwiches and drinks on the way back home. And yeah, everyone was happy. So,
So
it worked
good.
out okay. So when
love
one
it.
door shuts, another door opens. That's what I
Yeah,
always say.
you've done
Yeah.
an incredible job.
Yeah. So then in 2000, that was 2018, 2019, we opened up in the cities. So at 1 Collins Street, and now we've opened up a whole big day surgery with everything's on one site. So we have
All in one.
embryology, we have egg collections, we have embryo transfers, doctor consultations. In our clinic, we have GP fertility doctors. We have about 8 specialists that are also obstetricians, so they'll deliver your baby as well.
Wow.
And we have endocrinologists, we have acupuncturists, and dietitians. So we sort of cover off everything. And we also have a skin clinic. You can keep your
You
skin
are
looking
one busy queen.
yeah. So we can keep your skin looking good when you're on all those
That's the
IVF
best.
medication, because the IVF medication does flare up acne and things.
Yeah.
Because it makes your hormones go
All
a
out of
little bit
whack,
crazy
yeah.
at the time. So you get high estrogens and progesterones, which cause your skin either to get rosacea or pimples. So we have LED lights, heel lights, laser machines, which are all safe to do when you're egg freezing.
With acupuncture, just quickly,
Yes.
do you recommend that for trying to balance your hormones? I lost my period for 2 years
Yes.
when I was under eating, over exercising a long, like about 10 years ago. And acupuncture, I think, was the thing that brought it back actually.
Yeah, so we have 2 acupuncturists, and they do magnificent things to the patients. I don't quite understand it because it's a different form of medicine than what we practice.
Yeah.
But Caleb, who is one of our acupuncturists, he had about 20 patients today having acupuncture. So he does fix things like, sore shoulders, aching backs, headaches. Like some of the staff go and see him during the day if they've got a headache, and he just puts a few needles around their face and their headache goes away. So I don't
Amazing.
know how it works.
Yeah.
I can't explain
No,
it.
that's okay.
But,
Yeah.
a lot of
Just-
patients do it during their fertility journey.
Yeah.
Particularly on the day of their transfer, there is some good evidence that if you have pre-acupuncture before your transfer and then after your embryo transfer, that can improve your chance of success.
Yeah, amazing. Just to finish off, I could talk to you all day on this. You are just a world of knowledge, but you also have brought genetic testing with you, and I just wanted to explore what
so
that was.
This is really important because not many
Yeah.
people understand. Again, we weren't.
I
taught
don't
this at
understand it, so I'm actually interested.
yeah. So we weren't taught about this at school.
Yeah.
And probably the children with these conditions were hidden away from us, so we never saw them.
Yeah.
So this gene box here assesses for the most common genes, so cystic fibrosis, Fragile X, and spinal muscular atrophy. So cystic fibrosis, if you're carrying the gene and then your partner's carrying the gene, 1 in 4 children will be born with cystic fibrosis. Now, cystic fibrosis, you can either be a well cystic fibrosis child or a very sick child, which might end up needing to have a lung and a heart transplant and spend most of their time in hospital. So spinal muscular atrophy, sadly, I've had some patients born with babies that have had that condition, and the babies don't live past usually 6 months. Fragile X is a gene that 1 in 150 women carry, so that's quite amazing that no one knows about this.
Yeah.
And 1 in 150 of us are walking around with this gene, and that can cause severe mental retardation in boy babies to the point where you've got a baby that's banging its head against the wall all day. So really important to get this done. It's now covered by the government after Mackenzie's mission. Mackenzie was a baby that died from a rare genetic condition. The mum lobbied to the government to get this test done for free. So now this was about a $400 test for the patients. So they wouldn't take it up. They're like thinking, I've got to spend this on the IVF and that on my egg freezing. So I'm not
It's all
doing
too
that.
much, yeah.
So now our egg freezing patients are doing it, as well as all our IVF patients. And then this bigger gene box, this covers 500 genes and 1,000 genes. but this is more expensive. This is $900 with the government subsidy, so it was around $1,500 or $1,400. And the bigger gene test is now about $2,000, but a lot of people can't afford this. So next year we will be starting a charity with Sally Crinnis, and who sadly lost a baby from a very rare condition called Pompe syndrome. And so we're going to try and get this box covered for everybody.
Yeah. I mean, there's not a price on trying to understand your body more anyway, is there? But I
this would be a great Christmas present. If anyone's thinking of buying their child a Christmas present, this one I would only do if I had a partner, though. So it's like $995 for both of you.
And when should you take the test? Like what age?
When you're thinking about having a baby.
Okay, yeah.
This one we do when you're even thinking about egg freezing.
Okay.
So this one's more for when you're thinking about the baby.
Yeah.
And so that's a good grandma and grandpa gift present.
There we go.
Auntie or
Christmas
uncle.
time.
Yeah, a little Christmas to go in the Christmas box or bag. And so probably better than some of the presents we get at Christmas time where we sneakily take them back. So
Just
a
to
good
better your
present for
health.
anyone thinking about having a baby.
Well, Dr. Lynn, I am so grateful to have you on, as I said at the start, but I just wanted to finish by asking, what's your best piece of advice for someone in their 20s that is wanting to look after their egg quality and quantity and hormonal health?
Well, I think it's very important to stay away from the cigarettes,
the
vaping.
You've mentioned that. We've brushed over it.
Yes, vaping. I feel that people think vaping is healthy, even if they're doing the raspberry vapes and things like that. And so
blueberry vapes instead of the punnet.
Blueberry vapes. So no, vaping and party drugs and really cutting down on that alcohol. And the worst thing for your eggs is binge drinking.
Okay.
So having really loads of alcohol in one session, you're going to destroy your eggs. And I remember my grandpa saying to me, always look after the old person that you are going to become.
Future you.
Yeah, the future you. And he used to say that to me from a very young age, always look after the old person you're going to become. So look after yourself in your 20s and you're going to have healthier eggs in your 30s.
Thank you so much. I'm just so thrilled to have you on today. So thank you, Dr. Lynn.
Thank you, Brett, for having me.
And I'll link everything in the show notes as well. Thanks for joining us on Train the Brain podcast. If you would like to hear more from myself and my guests, then make sure that you subscribe, and I'll see you next time.